great to see all of you guys today. Hey, I wanted to jump in here for just a few minutes to tell you about our upcoming event, the Joint Health Weekend. This is going to be a fabulous opportunity for us to get together and learn some amazing information about how to keep your joints healthy and how to really focus on the long game when it comes to living with hemophilia. You know, living with any bleeding disorder is difficult, and there are things that you can do to help improve your joint health over time. That's why I'm so passionate about this weekend. You can get online and register for September 15th and 16th right now on our website. You can go to www.hope-charities.org. We're going to be doing a lot of fun giveaways and prizes and all kinds of things. But most of all, I'm really excited about some amazing content that we're going to be talking about as it pertains to people living with bleeding disorders. And today I've invited one of our guest speakers who's going to be presenting at this conference, Dr. Claudio Sandoval, to join me and to talk a little bit about some of the presentations that he's going to be doing, but also just how things are going within the idea of how to keep our joints healthy. So without further ado, Dr. Claudio, it is fantastic to see you. Thank you so much for joining me on this podcast today.
Of course, likewise, always a pleasure to see you and to be part of the Hope Charities. Has just, I've had many highlights in my academic pediatric hematology oncology career, and this is just one of them. And so really just thank you so much for having me and allowing me to kind of impart knowledge so that folks can make a good decision. We're all about patient autonomy. Yeah. A patient has the right to choose the therapy he or she wants. Nothing should be dictated to them. So thanks really for that opportunity. I really appreciate this.
Well, I really appreciate you saying that, because to me, one of the big things that I'm passionate about as an advocate for myself, my own family, and then of course just our community is helping patients understand the power that they have. I tell people this all the time. There's only 3 people sitting at the seat for a decision of choosing what medication you're going to choose or choose your own health. One is the physician, because obviously you have to write the script. The second is the payer, the insurance company. They play some role in telling you what you can and can't do, unfortunately. But the third is us. It is me. It is the patient. And if we as patients really understood the power that we have to make some of those choices for our own bodies, I think we would have a much bigger voice. I think we would have a lot more influence, but I also think we probably would have better outcomes overall, because we would be partially in the driver's seat with our partner, with the physician, to be able to make those decisions in tandem. And I think it would improve a lot about our community if we knew that strength, that power, right?
You're absolutely right, Jonathan, because you got to remember there was a time where there was only really Factor VIII, and really only Factor VIII derived from a hamster cell line. Well, now there's a Factor VIII derived from a human cell line. So now there's a discussion. There are non-factor therapies. There's more discussion. There is the possibility of newer non-factor therapies and gene therapy. So you can see how the discussion now is no longer, well, you need to take this drug because, one is the same as the other. Those days are over. Now to discuss therapy with a patient or the family of a patient with hemophilia, it should really take you about an hour or so to go through the pros and cons, the knowns and unknowns of all these therapies. And to kind of just dictate, you take this. I don't think you're doing, kind of the patient and the family a service, because remember, there's patient autonomy. Patient has the right to choose what they want to be given to them.
That's so true. I'm excited about that. And you're doing some amazing sessions at this particular weekend. I know that there's a lot of great things that you're going to address in terms of just being empowered and understanding more so we can make educated decisions. But one of the sessions I'm really excited about is, does Factor VIII have functions beyond coagulation? And there's a whole lot of science behind that I really find, I'm not an expert on the scientific side, but I appreciate people like you who really are vested with the knowledge and understanding of all this, so you can help explain it to me. So I know that session's coming up, but tell us a little bit about some of the talks you're doing and what you're excited about to communicate with us.
Sure. So, I think my favorite talk is going to be the one on bone metabolism. As you and I were discussing, we both have had issues with our bones. Me was a car accident related. You a bleeding disorder related. But to not be able to walk, it's got to be the most humbling experience that I've ever have had. And I've had many experiences, many heartaches, but not being able to walk just humbles you because we all take for granted that we get up in the morning and we just go to the bathroom and it's just done. It's almost as natural as breathing. But when you can't do that, you realize, oh God, I can't get out of bed because I can't walk. So I need someone to help me, or I'm wheelchair bound, or I need to be in a walker. So I really find that that bone metabolism and healthy bones and see, we all know joint disease. We're inundated with joint disease in the hemophilia arena. But now we're getting into like, well, maybe there's more to walking than joints. There's the actual, that bone that keeps us upright. So I'm really excited about that presentation, and it's important not only for men with hemophilia, but also women with hemophilia. This is the next wave, Jonathan. Women with hemophilia. No longer should any physician or any healthcare provider tell a woman she can't have hemophilia. That needs to be erased from all the medical textbooks and erased. Whatever neurons persist, they need to be ablated because that's just not progressive thinking. So now we really got to get after these women to stand up for themselves and to advocate for themselves and to not allow someone to tell them you can't have hemophilia because you're a woman. But then we also have to understand that they too are going to now experience some of the hardships of having hemophilia.
Yeah.
And
Yeah.
one of those hardships is decreased bone mineral density. So we're really going to try to bring that fact out. Another presentation is going to be talking about, how does a person metabolize a drug? So, we may read on the internet that drug X has a half-life of 18 hours. Okay. Well, Jonathan's half-life may be 48 hours. My half-life may be 5 hours. So I'm thinking, wait a second here. It's supposed to be 18. Why is mine only 5? You're thinking, hey, mine is 48. This is party time for me. So we're going to kind of introduce the fact that really pharmacokinetics is not the drug talking, it's the patient talking.
Yeah.
And it's the way the patient metabolizes the drug. So we're going to get into a little bit of that. That's going to be a kind of more of understanding some concepts of pharmacokinetics and what those actually mean to the individual patient. Okay, so again, patient autonomy. We're patient-centric here at Octapharma, and that's really what I thoroughly enjoy working here. And then the last presentation is going to be, we kind of wear different hats, Jonathan. I'm a son, I'm a brother, I'm a father, I'm a husband, I'm a colleague, I'm an uncle, I'm a cousin, I'm a this, I'm a that. So I wear 9 hats. Proteins are no different. Proteins may have many functions, some that we know, well established, some that we don't know, and perhaps maybe not so well established. So you may be hard pressed to say that factor VIII, factor IX, whichever coagulation factor you're addressing, has only one factor. That might be, kind of very narrow kind of thinking, when in fact, well, factor VIII may have other roles that are beyond coagulation, bone metabolism, the development of blood cells, tissue repair, and other things that we are going to discuss. Some have not yet been established, but there are some thinkings about what else does factor VIII do? Because again, some proteins have many different functions.
That's
And
so good.
a slight turn here makes the protein do this. A slight turn there makes the protein do something else. So, these are going to be fun talks. And really what we want to do is just get people thinking, you know, um, because this is really your life. You and I have discussed this. I started taking care of patients with hemophilia in 1985, and there
Wow.
was a lot of horrible things happening then, you know.
Mm.
And we've come a long way. We've truly have understood that this was a really terrible time. I speak to many women who are moms of boys with hemophilia who suffered from AIDS and even died from AIDS and or hepatitis, and how they feel that they're this wound and this pain that just will never go away. So we have come a long way, and I really genuinely hope that while I'm still alive, we can one day read in the newspapers, hemophilia has been cured. You know,
Mm.
not just changed from severe hemophilia to mild or moderate. We're talking about hemophilia has been cured. You know,
Mm.
and boy, will that be a good day, right, Jonathan?
It sure
That
will.
day that
You
we'll
know,
all get together.
you mentioned about the devastation of living without being able to walk and how that plays into bone density and so many other things that you're addressing in these talks. But many people know my story. I was in a wheelchair for 2.5 years, had both ankles fused, my right elbow had to be replaced 3 times from joint damage, and so this is an area that's I'm just really really passionate about. But one of the things that I really love about about where we stand, and again, you treating patients since 1985 and seeing how the many changes that have occurred, I do believe that for the majority of the community, there is this feeling of like, well, we've got treatment, and there's this kind of like, it's this breath of fresh air. It's safe. It's not, it's portable. There's some independence there, maybe, but I do feel like for those of us that have been around for a long time, we can look at the community and realize that there is sort of a little bit of a warning here, because I think largely people think joint disease is going away, or they think joint disease doesn't won't be a common problem anymore. And I think, again, I'm not the scientific end of this, but I do think that will still have joint problems. People still get in car accidents. They'll still have people are playing sports today in the hemophilia community far more than they used to. I think there's injury related things that will happen that will cause deterioration. We're seeing a lot of moms who were not diagnosed, and they should have been diagnosed with a low factor level, who are having to have knee replacements at age 35, 40, and because they had microbleeding occur in the joint. So there's a whole lot about this to me that I feel like an urgency that we need to have this conversation about how do we keep our joints healthy? And it requires us being vigilant over a long period of time. This is a marathon, it's not a sprint, and we've got to
Correct.
do the right things long enough to have the outcomes. And so this is why I'm so passionate about this topic, but I'm super excited about your specific breakout session about Factor VIII playing a role beyond just coagulation, but bone density, and there's other elements that are going on there. I think we do see things that are glimpses into the future that we need to be aware of and think about. And I know that particular session is happening on September 15th at 1 p.m. Central Standard Time. If you haven't registered yet, shameless plug for your session here, Dr. Claudio, but go register right now, because this is one of those sessions you don't want to miss. You only have to register once. You're going to be giving 3 or 4 of these talks, so that's super exciting. But you can register one time and get all the information and links. But I'm super excited and really appreciate the research and the work that you've done to get us as far as we are today. But I would agree with you. I think there's still more work we need to do, and we need to empower people for true autonomy in making the decisions that are best for each individual person, and not just cascading blanket standardizations. That's gotten us in trouble before. That's why we have women
Absolutely.
that are not being treated properly now. I think it could
Absolutely.
be a problem if we don't address this right here and right now.
Right. And I think also these types of presentations, Jonathan, afford families and patients to maybe ask questions they may not feel comfortable asking their
Yes.
healthcare provider. I mean,
Yes.
we let's I'm from my parents are from Colombia. So Hispanic folks view physicians as like these, near godlike persons. And how can you question the integrity, the knowledge, the intellect of a physician? We're not asking you to question their knowledge. We're only asking you to stand up for what you, this inherent autonomy that you are an active participant in medical decision making.
That's great.
So
I
we
love
hope
that.
that this affords patients the opportunity to ask the difficult questions that perhaps they just can't bring up to their physicians because of this profound respect that they have, and they think that, who am I? I may be a clerk in a store, or I may be a teacher. I'm just not as smart as a physician or a healthcare provider is. But that has nothing to do with it.
Right.
We all have the inherent right to choose what we think is best for ourselves.
I love that.
And as long as we are competent up here, because I mean, a patient can't go into a hospital and say, I have a splinter, I want you to cut off my hand. Nah, we're not going to do that. We're not going to do that. But a patient does have the right, if there are 3 to 4 different therapies, to think about it, unless it's an emergency situation, to actually think about it and say, you know what, doc, let me get back to you. Have time to reflect and speak to either my parents or my spouse or whomever, even perhaps get a second opinion. And these are really important things that we need to do for folks.
I agree, and I'm super thankful that you're willing to speak to this, to empower the patient to have the right conversations with their physician. We customize everything in this day and age. You go to the cell phone store, and they're going to walk you through all the steps of what you want on your device. You got to have a case that's your color and a whatever. And sometimes we kind of take the approach in healthcare. It's a one size fits all. Oh, you're having a cough, just take Sudafed, or something. I mean, it's just an automatic, thing sometimes, and that's really not anyone's fault. But
Nope.
sometimes, I know for me, and I can speak to this from experience, I went through seasons of my life where I had a higher metabolization problem on other drugs and had to change it up to try to find a greater, longer life hafting process. And even actually, I mean, just full transparency here, some of the drugs that were labeled long acting didn't do as good as the ones that were not labeled long acting. So it's all about your individual metabolization process, and that chemistry that makes you unique to who you are is very, very, very important for you to find the right balance for you. And we do that in everything else. Why not do it in medicine, right?
Right. And that you bring up such an important point, as we discussed earlier about pharmacokinetics. I mean, the label says 18 hours, but yours is 48 and minus 5. Where did that come from? You're like, wait 1 second here,
At mine, one time, mine was 4 hours. I had a 4-hour half-life on one medication.
Right. Yeah. And that's just the way it is. So that one medication ain't going to work for you.
That's
it's just
right.
not. Despite what anyone may feel or think, it's not going to work for you. So, you got to.
That's right.
And again, we're not pointing fingers. We're just saying that, look,
Absolutely.
with the more therapies you have to have these conversations. When I was in active academic practice and I had a patient with leukemia and I had a clinical trial open, I'd have to sit down with the patient, go through the clinical trial, explain to them the alternative to clinical trials, hand the consent form to the family and say, I'll be back in the morning. We'll talk about this further, but I want you to think about what we talked about. Here's the consent form. If you want to enroll your child on this clinical trial, then you have to sign this consent form. So I'm giving them the autonomy to decide whether or not they want to enroll themselves or their children, their legal wards, onto a clinical trial. And that takes time.
It does take time.
That takes time.
But I appreciate the efforts in doing this. I know this is a big deal because if I understand it right, I think we have 19 drugs that are in the pipeline. If you don't get educated now, you very well are going to be in a real bind in a little while. So now's the time to really understand what's available to you and to understand it yourself so that you can have an educated decision with your doctor. And I'm just excited. So thank you so much for being willing to speak. I really appreciate your investment in our community. And I look forward to seeing you very, very soon.
Likewise.
All right. We'll talk to you soon.
Thank you so much, Jonathan. Be cool. Ciao.
Man, what an exciting time this is going to be. I just cannot believe that we're going to have an opportunity to be able to have such a great discussion about this. And Dr. Claudio is one of the best. I've already gotten text messages and emails from people saying, man, Dr. Claudio is just one of the best. And so if you didn't catch that time, make sure you register for his session. One of the ones we just talked about was, does Factor VIII have functions beyond coagulation? I think that's a very important conversation. September 15th at 1 p.m. Central Standard Time. If you haven't registered yet, you can go directly to our website at www.hope-charities.org and register right there on the homepage. One registration gets you access to all of the sessions, so you definitely want to take advantage of that. We're giving away a ton of gift cards and prizes and some amazing things that are going to be happening. It's going to be a lot of fun. If you have any questions and you're thinking, gosh, I don't know if this or that, or if I should go, or if maybe my daughter should go, or my husband should go, or who I should get to come with me on this, you can always email us at events@hope-charities.org, and we'll be able to make sure that we answer any questions that you have. But once again, a big thank you to Dr. Claudio for joining me today on the podcast and getting the opportunity to be able to talk a little bit more about this. And boy, I look forward to spending more time discussing this in depth with question and answers and all kinds of things. It's going to be a great weekend. So stop what you're doing right now. Go click on the link and register. You can click on it right down here below in the comments, and make certain that you come and hang out with us very, very soon, just around the corner, September 15th and 16th. And we will see you soon. Take